Hey, good morning, everyone. It's Tuesday, about 7:45, and I'm Chris Wilson coming to you from upstreamvitality.com, and just wanted to, discuss some things. And from here on out, whenever I do these recordings from my truck, I'm going to put those under the trucking series because I know these aren't the greatest videos. They're not the best of quality, and for a lot of people, they don't like to watch, low quality videos, and so I get that, I know. So these are just going to be like a talking point series from my truck whenever I'm driving on the road, and I can condense these and take all the hot topics that I speak about in these videos and put them into other more professional looking. But I just wanted to throw that out there for you, so just be on the lookout those videos. But anyway, I wanted to talk about mercury poisoning again, because mercury poisoning is something that has hindered the health of my wife, and we are slowly on the road to recovery with her health returning, and it's been a struggle. And I want to talk to people about the dangers of mercury. You're probably wondering, where the heck do I get mercury poisoning from? Well, your dental fillings, for one, they come from, they're called silver fillings, and they're 50% mercury. You can go to YouTube and type in the search box, the smoking tooth. There's like a 30-minute video, and then there's a condensed version that's like 8 minutes. Anyway, they show a 25-year-old tooth that they put under strenuous, I don't even want to say strenuous, they just aggravate the tooth, meaning they expose the tooth with a toothbrush, like as if you're brushing your teeth. They put heat to it to emulate what it would look like if you were to drink coffee or hot tea, any type of hot liquid, soup, bone broth, etc., hot food, whenever you chew on it. So basically any type of stimulus to the tooth causes the mercury vapor to off-gas, and they have a special lighting and screen where you can see the actual vapor coming off of this 25-year-old tooth. And I emphasize that because so many dentists will say that, well, you only have off-gassing of mercury, or you only have the mercury that off-gasses, for the life of the tooth, which is 7 to 8 years, and it's trapped inside of the amalgamation from the silver they put into there to help keep it locked in. But that's untrue. Most mercury fillings are banned in all other countries. So why are they still allowed to have that here in the United States? Well, because it's cheap and easily accessible. And so for those who want to say that they can put those in their children's teeth because they're only in their baby teeth, look, mercury is a known neurotoxin. If you won't give your child vaccinations because they have thimerosal, which is a mercury adjuvant in the vaccine. Now, I don't want to talk about the other reasonings of why we don't do vaccinations, but I'm just speaking for the simplicity's sake of mercury. Then why would you allow a dentist to put mercury in a filling? You can go find and search for dentists who do take Medicaid that uses composite fillings instead of mercury. They might be a little bit harder, but I highly encourage that, just because of what I have experienced with my wife. My wife had mercury fillings, I think 8 of them, for 12 years in her mouth. The sad part is that she had them put in while pregnant with our oldest son. And the reason why that's sad is because it's obviously going to transfer into his body. And as I've already discussed, and as I put up on my website, when you go in there and read, through the EWG.org, that's the Environmental Working Group, they have studies that show newborn babies coming right out of the gate, right out of the womb, are found to have 286 or 287 chemicals in their umbilical cord, and this is obtaining them through utero. So whenever the mom, whatever she's exposed to, the toxins are going through into the umbilical cord, and those are going directly to the baby. So We got to be careful of what we're doing, because here we are being born with just shy of 300 known chemicals within our body. And, we're already exposed to all these toxins on a daily basis through the air we breathe, the food we eat, and the water we drink, and whatever we're putting on our skin. Anyway, mercury poisoning is, it's so debilitating to your health. There's so many unexplainable symptoms. It's unbelievable. The different types of chronic pain that my wife explains that she has. The unexplainable bloating, gas, or mainly, it's not even really gas, it's mainly like bloating, where she has this balloon-like feeling in her stomach that swells up. And it's almost after every time she eats, she has unknown food allergies where she has allergic responses to many different types of foods. And normally you're like, there's no way that can be mercury only, but I'm telling you, it is. Mercury has these abilities to give off so many unexplainable symptoms. And when you research on PubMed or wherever, PubMed is a public medical database of records, and you can sort through those to have peer-reviewed meta-analyses to look at like really good, high-quality articles from doctors about whatever topic, in this case mercury. But mercury toxicity is real, and a lot of problems is people will get hair mineral analysis tests, urine analysis tests, or even blood work done to see if there is levels of mercury within their body. And the problem with those tests is oftentimes they'll come back showing you that you're a normal, healthy person, because those tests are really only designed for people who are poisoned in an acute manner, meaning they've just been exposed to it. Say like a mercury thermometer breaks and you get involved with some mercury getting into the bloodstream, and you go get tested and it's going to be there right away. But for people who are chronically ill like my wife, these mercury toxins won't show because they're locked away deep into tissue, specifically the brain, and they just completely throw off the HPA axis, the hypothalamus pituitary adrenal axis, which is your control center that regulates most of your, if not all, of your hormone production, causing adrenal burnout, chronic fatigue. You can't handle stress. The body doesn't have the ability to adapt to stress the way it needs to. And this is all due to mercury toxicity locked away in the brain. So you have to use a true binder, a true chelator, which means the removal of the toxin that'll pull out the toxin. And then whenever it gets put into the bloodstream to be excreted, you can run what's called a heavy metals challenge test on a 6-hour challenge, meaning use these binders or chelators to pull the toxin out of the tissues, and then you can go through one of these urine analysis tests and see how much heavy metals you're excreting. It'll give you a good idea of what you're high in and how much is still locked into you. And it takes time to get this out. It really does. And it's a bummer because it can destroy hope. You have unexplainable symptoms and you go to doctors to try to get this stuff figured out, and most conventional practices and conventional doctors in the medical community will make you think it's all in your head, and they want to chase these symptoms with they want to chase these symptoms with other band-aids that is not going to fix the actual problem. And so it can be a pain. And I encourage you to follow me on this journey as I do everything I can to heal my wife. We've already, back in February, got her amalgams removed and the hidden infections removed out of her mouth from the cavitations within her wisdom teeth and the infected root canal in her gum line, jawbone. So we've got them removed, and now it's time to do proper chelation, meaning to remove the metals that's locked deep into her tissue. And again, mercury is a known neurotoxin. It is a chemical. The metal is soft enough to go beyond the blood-brain barrier. Now, if you think of the blood-brain barrier, it's the small barrier that protects the brain. It's the gatekeeper, if you will, to protect the CEO, to screen who can come in and who can come out. Well, the mercury is, crafty enough to sneak past the gatekeeper and get inside the office of the CEO to deceive him, basically, and get in there and poison him slowly. And so what happens? How does this toxicity build up? Well, over time, it accumulates, and that's called a bioaccumulation, because as you've got the toxins in your mouth and the cavities, and you're brushing your teeth, drinking hot teas, eating food, chewing gum, chewing food, doing whatever, again, as I said earlier, it stimulates the mercury to off-gas, and then you're breathing that chemical in, and it's getting trapped directly into the brain and getting locked away into the tissue. And so you're building up this toxin over time. Think of 12 years of breathing in mercury gas, and you have all of these unexplainable symptoms. I'm telling you, it's because of the mercury poisoning. And it's a true bummer, because it's very frustrating. And you just got to, stay encouraged and keep your head up and just keep, doing the best you can to limit your exposure to different types of toxins, especially glyphosate. Glyphosate is a known neurotoxin, a known carcinogenic herbicide. I'm pretty sure it's a neurotoxin, but it just wreaks havoc on the gut, and it tears holes in the gut lining, which leads to leaky gut, which will then lead to autoimmune conditions. So you take your mercury toxins that you got in your mouth, that you're off-gassing from stimulating through chewing and everything else that you do with your mouth. You're breathing in this vapor, getting it locked deep into the tissue, destroying your HPA axis, you're disrupting your endocrine system through the mercury. Now you're eating GMO foods, heavily processed fast foods or GMO foods, wreaking havoc on your gut, allowing undigested foods and proteins to get into the bloodstream for your immune system to create antibodies to attack yourself. So you're putting your body under constant stress. And it's these stresses that will allow your toxic burden to overload and eventually just crap out, for lack of a better term. And this is why we see these modern epidemics of autoimmune cases on the rise that lead to metabolic syndrome and just gut dysbiosis, leaky gut, and all these other symptoms of people not knowing why. And then teen depression, we don't understand why, but if we can understand the concept of these kids are born with just shy of 300 chemicals within their body, they're brought up eating high processed diets of sugars and grains and breads and crackers and processed fast foods, McDonald's, and all these trans fatty acids. We're dooming them, and we're wondering why at 12 and 13 they're having behavioral problems, and they're not wanting to, their body, see, as a child, their system is not fully developed, so they cannot process and cope with the stressors of life as, say, an adult would. And even adults have a hard time. So these kids are put on antidepressants, Zoloft and Xanax and Valium and psychotropic drugs, and they're put on ADHD or ADD because lack of attention span and lack of focus. And it's the wrong problem. We're treating, it's like trying to spray gasoline on a fire, and we're wondering why the fire is getting bigger and it's not going out, because we're using the wrong agent, and we're not seeing that, okay, we need to do something else to address the cause that's causing the fire. And that's what's happening with these children, and nobody understands. We just think that, oh my goodness, there's just something wrong with them. They were born this way. Maybe it's genetic lottery. No. The environment that we expose them to is what's causing their ailments and giving them these debilitating diseases. And so we have to do our best, because we're already in an uphill battle trying to win a fight that hard enough to win. But if we can choose to do as clean living as we can through what we put in our mouth, what we eat through an organic lifestyle, clean water, and not vaccinating your children, not getting them mercury dental fillings, and just trying to do our research to go about it the right way. I'm just sorry, that's the life that we live today, and we have to properly educate ourselves to take care of our children and ourselves, and to teach them. It really sucks. It does. And you know, I just wanted to kind of put that out there so you guys can have a little bit of an understanding of my heart's passion and where I'm at on where I'm trying to teach my family. I mean, they might think I'm crazy and weird, but I'm hoping that as they grow older, they'll understand, that's what my dad was saying. That's why he was so passionate about this. That's why he always ranted and went on and griped at me for eating nothing but cupcakes and muffins and Big Macs and sodas. You know, I get it. Every now and again, it's okay. But to do it every single day, day in and day out, you're just setting yourself up for failure. And you're going to pay for that. Someday or sometime in your life, you're going to pay for that. And it's whenever we have an accumulation of all these toxins built up over time, that is when our bodies go on a downward spiral and we begin to lose control. And we just got to be real careful. And anyway, in the next video, I'm going to talk about oxidative stress on this trucker series. But I just want to give you guys who are out there trucking along with me something to listen to and hear. And I can't go live because I don't meet the eligibility requirements. YouTube changed their eligibility requirements. I would love to go live so you guys can interact with me and I can answer questions and whatnot. So please leave your comments. I do go back and read every single one and respond to as many as I can. So please leave comments. Let me know what you think. Please encourage me. You know, let me know that I'm not the only one doing this and that you're fighting this battle with me and that we can join alongside hand to hand to educate people. Check out my website, upstreamvitality.com. I'm almost done with it. I think I just got to go back through and make sure each link goes to the corresponding place that I need it directed to. And, you know, I've almost got it completely set up. I spent literally all day yesterday tidying it up, and I'm going to continue doing that, obviously, but I've almost got it to where I want. So yeah, let me know what you think of it, how it looks, how the feel, the ease, the accessibility of the site is, and if there's anything that you recommend I should change on the website. And yeah, I appreciate you tuning in, and you know, have a wonderful, blessed day. And please leave your comments and feedback. I'd love to hear from you, what you have to say, and I'll be with you on the next one. So take care.